Paula, and I'm back to say congratulations, you've made it through 8 weeks of Women in Control. We've really talked a lot these last 8 weeks, and today I'm just going to review what we've discussed. Just sort of talking about the objectives of our discussion today. There are a few main points. One is I want to review with you the importance of movement, healthy eating, and stress reduction. I'm going to touch on how positive self-care and self-monitoring can really enhance your health. And finally, identify those tools of self-management so that you can care for yourself on a daily basis. So the first thing I want to do is just a review of wellness. In the last 8 weeks, we have touched on a lot of different topics. We started with a conversation about self-monitoring, noticing what's going on in our feet, monitoring our eyes, our hands, our skin, and really importantly, monitoring our blood glucose with our glucometers, and how that feedback can help us make really good decisions in our lives. Secondly, we moved into the idea of mindfulness strategies, noticing what it's like to be in the moment, in our bodies, with ourselves in the moment. Things like meditation, walking mindfully, the chair yoga we did, these were all different examples of using this mindfulness skill of being in the moment, just noticing what's happening, not worrying about the future, not worrying about the past, but just really allowing yourself to be here now. And when thoughts come into the mind, or emotions or worries come into the mind, to let them go. We talked about glucose control and how can we do that by exercising and eating right. Do you remember this fact that when we exercise for 20 minutes, that glucose comes out of the fat, out of the blood, and into the muscle? And that was one key way we learned to reduce our blood glucoses. Also, we can reduce that by watching what we eat and focusing on whole foods. Not white foods, things like carbohydrates, donuts, white bread, white cookies, but whole foods like vegetables, fruit, and protein. And don't forget the fiber. That is also a key thing. Remember, fiber makes you full, so you eat less. From there, we took a journey around medication and what medications work, how they work in your body, and really discussing the barriers for taking our medications and how can we overcome those barriers to take our meds every day and that importance. We moved on to a conversation about inflammation in the body and how we can reduce inflammation in our heart, in our blood vessels, and our kidneys by eating an anti-inflammatory diet with different spices, fruits and vegetables, and foods rich in omega-3 fatty acids like fish. We also talked about stress and how stress can lead to inflammation. Another wonderful reason to reduce stress. Finally, we talked about our beautiful bodies and how they come in all shapes and sizes, and embracing that, embracing our bodies and knowing that we are all beautiful, and to engage in caring for ourselves. Where do we go from here? Well, there are some yearly things that you can engage in to really master your diabetes and keep your body as healthy as you can. And these can be things that you can do in your primary care office with your clinician. One is getting your eyes checked. Getting a good yearly eye exam is really important because diabetes can affect the eyes. remember to check your feet, to avoid any small cuts or ulcers, and to wear your shoes at home. In terms of things that we do in the routine primary care visit, there's actually some testing that we do. With a little sample of your blood, we can check lots of different things. One is a test called a hemoglobin A1C that tells me how your glucose has been for the last 3 months. And that can be really helpful in terms of long-term planning around the diabetes. We also can check your kidney function or how well your kidneys are doing with a blood test. And finally, there's a molecule your body makes, you may have heard of it, called cholesterol. And what we know is that that molecule that goes through the blood can cause heart disease. And when the sugar or the glucose is high, our bodies make more cholesterol, and therefore we can be at higher risk for heart disease. So another simple blood test we can do in the clinic is a cholesterol level. And finally, there's something that the doctor does, and you may do at home, and that's to check your blood pressure. The blood pressure is another way that we monitor to make sure that you're healthy, and that if the blood pressure is low, meaning that the heart is pumping well, then that means that the overall health of the body is really good. The last thing for this conversation that we're having today that we're going to talk about is intentions. What is it that we plan to do, and how do we follow through with that? So when we think about setting an intention, creating a vision for ourselves, there is a way that we can think about it systematically, and that's the idea of being SMART. So it's an acronym for a larger way of thinking about things. The first S in SMART is specific. What do you really want to achieve? What is specific about your goal? So for example, my goal might be that I want to walk 3 times a week. Second, is it measurable? How will you know if you're successful? Can you measure that outcome? So for me in my walking goal, I might have a pedometer or be able to track the number of steps on my watch or phone, so I can measure the amount of steps that I'm taking. The A in SMART is achievable. Can you do it? Is it realistic? So for me, walking 3 times a week is something that's achievable. I'm not setting it up so I'm walking 7 days a week. I'm only going to go for 3 days a week. R is realistic. Is it realistic? Is this something that you can do for a long time? Can I be realistic about, yes, I can walk 3 times a week? And finally, time. When do you want to achieve this goal for? How long is it going to take me to feel like I can achieve walking 3 times a week? So there are many different types of intentions that you all have set each week for yourself. Eating more vegetables, dancing, drinking lots of water, taking your medications as prescribed, and even cooking at home. Those are all great, SMART intentions to be having. So, in closing, I just want to say that when we went about developing this program, Women in Control, we did it because we really wanted to give women the tools to embrace and take care of their bodies and to control their diabetes. Because there are a lot of women who are successfully caring for their diabetes, and you can too. Because you are the most important person, and it's important to recognize that your health is very, very important. It is key and central. And although there are a lot of external factors that focus on caring for other people, whether it's caring for our children or caring for our family, our friends, remember, by taking really good care of ourselves, it helps us take care of others. you're also the key component to your healthcare team. To know that although the clinicians, the doctors, the nurses, the physical therapists are there to help you, you're the leader of the team, and it's important that your voice be heard. We talked about the idea of daily intention of caring for ourselves, like exercising, eating right, reducing our stress, as a way of preventing those problems downstream, like problems with our eyes, problems with our feet, having to go to the hospital or the emergency room. That daily care that we take care of ourselves is going to prevent those things long term. We want for you to be able to learn as much as you can about yourself. And remember that diabetes is a disease that you can master and that you can control, that you have the tools, and always remember that you are a woman in control. Diabetes is not going to control you. You can control your diabetes.